that we found very little evidence, in fact we found no evidence, that the use of dental floss in patients who have gingivitis or periodontitis confers any benefit whatsoever in terms of efficacy. So the flossing story appears to be a big myth without any evidence whatsoever in patients who have some kind of space between their teeth. And it's very clear that in that situation the use of these small interdental brushes, the mini interdental brushes or the bottle top interdental brushes are effective when used as an adjunct in addition to mechanical cleaning. They are very effective at reducing plaque and also at reducing inflammation. But we don't have that evidence for the other agents such as toothpicks, dental floss or the oral irrigation devices. This is a very important finding. We need to be careful how we transmit that message to the public, because that is not to say that floss doesn't have some role to play. But the only role it would appear to have to play is where we have no gaps between the teeth and we have a healthy situation. And in that situation it may not be possible to use these other devices. Where that happens, then floss is something that we would suggest is worth using, even though we actually don't have any evidence. That doesn't mean it doesn't work, we just don't have the studies to prove that it works in that healthy situation. You know, for many, many years people have advocated dental floss for patients who have periodontitis or patients who have gingivitis. And this is almost ingrained into the mindset of the dental hygienist and therapist and the oral health educator. What this workshop is telling us is there is no evidence for that in those situations at all. The only evidence we have relates to the use of the interdental brushes. And there is evidence there that they are effective in reducing plaque levels and also in reducing inflammation, gingival inflammation. I think what it means for the profession is we're going to have to do what we are expecting our patients to do, and that is we're going to have to change our behaviour. We're going to have to change our mindset and our behaviour to accepting that floss actually doesn't have any value in patients who have had periodontitis, or in fact in those who have gingivitis, but it may have value in people who are healthy and preventing the development of gingivitis. And we're going to have to essentially get over the fact that that's what the evidence tells us and start recommending the interdental brushes instead of floss for patients with gingivitis and for patients with a history of periodontitis, provided they fit between the spaces. Now, that raises another issue, and the issue it raises is that we really need professional guidance and professional demonstrations of those oral hygiene methods. Because the other thing we've been able to show is that if you have professional guidance as to how to use these oral hygiene aids, that is effective in reducing levels of plaque. The evidence tells us this. And there's a real danger sending patients away without demonstrating how to use these interdental cleaning aids, because if they're healthy, they could cause trauma. Trying to get it between the space, trying to get the interdental brush between the space may cause trauma. So we need to be very careful in how we convey those messages. What we found is that there is evidence that power brushes, and it seems to be the rechargeable brushes, they tend to be the more expensive, higher end brushes. So we can't extrapolate these findings to the battery operated brushes. Those power brushes appear to be more effective at removing plaque than manual toothbrushes, significantly more effective. And there's some limited evidence that that may impact upon gingivitis as well. The difficulty we've had is that it's one thing to show enhanced plaque removal, that doesn't necessarily translate to a reduction in gingivitis. And the reason for that is that the way that we are measuring gingivitis is not necessarily that, it's not really that sensitive. And so we may be seeing changes happening, but they may not be measurable, even though they are actually happening, if that makes sense.